when I drink, it goes to my mind. I do terrible things, and whilst other people could drink responsibly, like my friends could drink a glass of wine and leave the rest of the bottle for tomorrow, but there are people who are like me who can't stop, can't leave a glass of wine.
I have a child, but drugs took that child from me. She's still alive, but drugs took her because I don't have time for her. I don't have anything to offer her. All I have is all about my fix, all about my drugs. The drugs of choice that I have to choose between my family and friends and people who love me most. But I did choose drugs because I could not do anything without drugs that time. I can't go to the toilet without drugs. I can't eat without drugs. I can't sleep without drugs. When I wake up, before to go to street, I must smoke.
The kind of drugs I was into was dacha, ket, and then crystal meth. And then now at the later stage I started experimenting mandrakes because I needed to calm down.
So substance abuse contributes immensely to the global burden of disease. Now, it not only harms health, safety and well-being of those affected, but also has negative impact on healthcare expenditure, loss of productivity, involvement in acts of criminality such as gender-based violence, and a whole host of other negative effects on social welfare. So today we discuss alcohol and substance abuse. Our guests will help us understand this topic by unpacking issues such as patterns of abuse, reasons for abuse, prevention, treatment, and rehabilitation. Now, our panel is comprised of the head of psychiatry at the #1 military hospital, chairperson of the Central Drug Authority from the Department of Social Development, non-alcoholic board member from Alcoholics Anonymous South Africa, and an inpatient manager from Westview Clinic. Now, we also have two individuals who share their personal stories of how they have overcome the addiction problem, one with alcohol and the other one with drugs. Now, you can tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
Because it seems like the soft rain, but it can be dangerous.
Yes, it can. So what happens is it starts off softly. So there are moments for an hour or 2 hours where the rainfall really falls really hard.
Mark Ketla, a very good morning to you. What are you witnessing out there?
As you can see, this is Yakske River in Sijeta, Alexandra informal settlement.
We've got issues with cars that can't drive here.
Usually when it rains like this road really becomes problematic.
Current situation in the Ventura area is that 10 people were rescued when they had been cut off by the water.
This amount of rain is not something we could have prepared for.
Here's a minister who says, I'm working on some sort of plan.
There's no way that we can agree to pay workers less wages. There's no way we can agree to domestic workers being paid less than what they currently get. We can't agree to farm workers being paid even lower than the slave wages they earn right now.
What is the role of lawyers in the fight against corruption in the country?
We've seen lawyers who knowingly that this client or who would have a reasonable apprehension that my client could be paying me from proceeds of the crime. I think it's about time that we legislation somehow considers how to discourage that type of conduct by lawyers themselves.
Where are the gaps as a person who has thoroughly interrogated the 4IR space and how it will have impacts on the country?
One of the unfortunate consequence of the fourth industrial revolution is the possibility of increase in inequality.
Dimpho Mokoena, not her real name. She started drinking at the age of 16 and she explains how she got addicted. We concealed her identity due to the AA policy to remain anonymous.
We went out with some friends from church and then they had a little bit of booze with them. Then I wanted to try some, and then I drank, and for the very first time that I drank, I blacked out.
Fast forward years later, Dimpho succumbed to peer pressure, and that's where the addiction began. She became a functional alcoholic.
I started drinking again because of the heartbreak that I experienced. Then a friend of mine suggested, no, have a drink, then you'll forget. Then as from that day, I never stopped drinking, but I wouldn't drink during the week, or occasionally I would binge drink. I would just drink on weekends and then stop after I passed out or blacked out, and then serve my papalas period, then drink again.
Dimpho is a mother of one. She's also unemployed due to her addiction. Motherhood and unemployment didn't stop her from taking alcohol.
There was a day when I left my child at a friend's place, and we locked the room and left the heater on, Thank God that nothing happened, but a lot could have happened that night. Because I know that sometimes my mom would ask me, where's your child? And I'd say, I don't know. And I'd be telling the truth, I don't know where my daughter is, because I'm drunk, I forgot about her.
It took her years for her to realize that she's an alcoholic. According to her, she thought she was normal.
I didn't think that binge drinkers are also alcoholics. In my mind, alcoholics are people that drink every day.
Dimpho got help from AA. She was surprised to only find men attending the meetings. She feels it is important for women to also attend the meeting.
The saddest part about women who drink is that a lot of things happen to us while intoxicated. We put ourselves in danger. You get raped. You sleep with people you don't know.
Regaining trust from her family as a recovering addict was daunting. She always had to justify her happiness.
I got sober in November, so during a festive season like this, she would, when I'm happy, she'd come right in front of my face and smell my breath. So I would see her that she's very uncomfortable and she has trust issues around me.
As a recovering addict, she wishes people would be open and welcoming to those living with addiction.
When you drink a lot, people seem to think that you just lose or doing it in purpose. But I just wish that, especially our black community, if they could be educated about Alcoholics Anonymous, instead of us being judged, rather give a helping hand.
Okay, so let's go straight into the subject, and we're going to introduce my special guest for today. It's Dr. Jan Shabalala, who's a psychiatrist and head of department at this #1 military hospital in Pretoria. Welcome to Health Talk, Dr. Shabalala.
Thank you, Dr. Mtaung.
And Dr. Shabalala, by the way, is head of psychiatry at the #1 military hospital. We also have Dr. Veroshni Nadison. Now, Dr. Nadison is a non-alcoholic board member from Alcoholics Anonymous, South Africa. Welcome to Health Talk.
Thank you.
And by the way, he is also a social worker by profession and lecturer of social work at the University of Johannesburg, correct?
That's correct.
All right. And we also have David Bear, who's the chairperson of the Central Drug Authority from the Department of Social Development. Welcome to Health Talk there, David.
Good morning. Thank you very much.
All right. So let's start from the beginning then in terms of, these basic concepts. Just, there's use, abuse, addiction. Can you just take us through that chain?
Yeah, we as we're approaching the festive season, there's going to be a lot of alcohol floating around.
Right.
And there's kind of people who will use alcohol, and by using, I mean using responsibly.
Right.
As you can see on the labels, drink responsibly.
Right.
But then there are those who are going to abuse it and who have been abusing it.
Right.
And how do we define abuse? Abuse is the use of any particular substances that results in harm.
Right.
The harm can be either physical, bodily harm, or even mental, the harm to the mental state of the person,
Right.
or the harm to the social life.
Right.
So that is abuse.
Okay.
And then we get to people who are addicted to it. Now, people who are addicted to it cannot do without it. They have to get a regmaker in the morning. I like the word regmaker in Afrikaans because it's very descriptive.
Yeah.
It sort of they have to get something to get them going.
Right.
Just like I would have coffee in the morning.
Yeah.
People would like alcohol to keep them going. And those people are addicted to alcohol. They cannot do without it.
Yeah.
And there are those who are dependent on it. Now, those who are dependent, it's more serious because without alcohol, they develop withdrawals.
Yeah.
You know, so when we talk dependence, we talk people who will withdraw, who will develop withdrawals when they're not using alcohol.
Yeah.
But all of those patterns are all patterns of abuse of alcohol.
Yeah.
And then there's something that I want to clear onto the viewers.
Yeah.
A person comes to me and said, "But doc, I drink only once a week on weekend," and I tell them, "You're still an alcoholic."
Yeah.
And they get very upset.
Yeah.
It is that kind of pattern where a person takes alcohol once a week or even once a month, but when they get it, they drink it to blackout.
Yeah.
That is alcoholism. That
Right.
is alcohol abuse.
Right.
So people must not fool themselves that by being sober during the week and getting completely sloshed over the weekend,
Yeah.
I'm better than you because you drink every day.
Interesting that somebody asked me the question, what constitutes an alcoholic? Now, are these used interchangeably? Alcoholic, alcohol abuse, alcohol,
People use it
addiction?
interchangeably, but for ourselves, in terms of trying to do rehabilitation, we actually do a bit of nitpicking because the approach may be different in different various groups.
Yeah.
For example, a person who abuses alcohol may have an underlying problem.
Yeah.
And for me as a psychiatrist, things to look at, I'm looking at depression, I'm looking at anxiety,
Yeah.
I'm looking at other things. A person might, for example, be trying to cope with pain, pain being physical pain or mental pain or whatever, or the combination of the two. So in a person who's now addicted, we're looking for other patterns, what are other causes and other risk factors. So it's different.
Okay. Let's get a perspective from Alcoholics Anonymous, Dr. Nelson. So let's look at the patterns. We're told that alcohol is the most abused substance. And then, by the way, we need to define what we mean by the word substance. Just take us through that.
Well, you have various substances. Alcohol is but one of those substances. You also have drugs, and drugs has been in the news for various reasons recently, particularly with the legalization of cannabis for private use. But from an alcoholic, from an AA perspective, we look at a person's sensitivity to alcoholism or to alcohol. You may have a personal sensitivity, or you may have a mental obsession. And that contributes to self-diagnosis on whether you're an alcoholic or not. One can call themselves an alcoholic even when they have recovered, because we do believe that you are just one drink away from reverting to alcoholism.
Yeah. So who tends to abuse? Who are these people that abuse and get addicted?
I wonder if we could define it, because if we all come from vulnerable communities, our communities are such that in society, it's a well-known fact that alcohol is available, or it will be available at almost all social gatherings. Children from a young age are socialized into believing that it's okay for adults to drink, and so children then believe, why not I now engage in alcohol?
In fact, we're going to come to risk factors, in fact, just now. But let's get, from the Department of Social Development. First of all, I think not too many people know about the Central Drug Authority. Perhaps just explain to us what that is and what you do.
So the Central Drug Authority is a statutory body appointed by the Minister and by Parliament in order to advise government on all issues around substance abuse. And when we're talking about the issues around substance abuse, we're talking about the licit and the illicit market, because they both present exactly the same problem areas. So as a statutory body, what we define as the substances that need to be dealt with, and how best then to rehabilitate those people who unfortunately become victims of the problem and the scourge that we're having in the country. We advise government, we advise Parliament, we advise the Minister, based on all the scientific evidence that we glean from the international arena and also from our own local statistics as well.
Okay, talk about statistics. You keep statistics, just give us a sense of what is being abused, when, and where.
So I think that importantly we need to understand that we make no distinction between the licit and the illicit market.
Right.
If the substance is being abused, and here I'm talking now about substance being in the broader term.
Right.
If it's being abused, if it's being misused, if someone becomes dependent on it, we have to apply exactly the same standards in order to try and help and to prevent that from happening as well. Therefore, what I'm saying is that whether a substance is a legal substance or an illicit substance, the same principles apply. We talk about what is available in the country. Whatever you find anywhere else in the world is now available in South Africa as well. And this is the problem that we have, where we've got the new psychoactive substances that are being produced internationally. We are also producing them here locally in South Africa. For example, we are now exporting our tuk to other parts of the world. So we are creating the problem for our own community, and we're also creating problems for other parts of the world as well. The type of substances that are available, the cocaines, of course, of the world, they've always been there. The amphetamines have always been there. The heroin and the opioids and all of those, whatever is internationally available is now available in South Africa. There is absolutely no distinction between any other part of the world. What is more concerning is that while there used to be a lapse between the discovery of these substances internationally, we are now finding that within a very, very short period, we are finding them exactly the same on our own shores in our own country.
Right. There's one aspect we shouldn't forget, and I think it's important for us to just touch on it a bit. We're talking generally about substances, alcohol and drugs, but there's other issues, prescription drugs, painkillers and that sort of thing. Do you want to comment on that perhaps?
Yeah, in fact, it's interesting, we were just talking, is it a couple of years earlier? We spoke about the codeine initiative. People abuse lots of over-the-counter, and the major one that is being abused is codeine, because codeine calms people down. In fact, codeine gets modified in the body into heroin. So people get the calming effect. So codeine is one of the most abused medication. There's cough mixtures, and these days our youth have discovered that you can mix cough mixture with a certain lemonade drink, whose name I won't mention, and shake it up and gives them a potent substance. In other words, all kinds of medications, painkillers being the number one, and then you get to sleeping tablets, benzodiazepines between you and I, sleeping tablets, but virtually anything that has got mood-enhancing effect can be used that is sold over the counter.
Okay. We're going to go for a quick break. When we come back, we'll try and understand the risk factors for substance abuse. Please stay with us.
We believe that the fourth industrial revolution can change things for us.
We can do telemedicine. Now that means that over a long distance or any distance, I don't have to go and visit a doctor. I can actually see the doctor online.
In Africa, we don't have sufficient doctors. In Africa, we don't have sufficient clinics. It actually makes sense.
Wi-Fi and 5G technology formed some parts of the conversation that took place right here.
5G, of course, has the advantage of better experience and also the high efficiency when it comes to the cost per bit.
We haven't issued spectrum in the last 10 years. We have 4G today, which we have had to harvest spectrum from other technologies to be able to get 4G, and now it's costing us a lot more money.
Many, if not most, small, medium enterprise businesses are making technology their own businesses.
On Network every Sunday at 8:30 p.m.
Here's a minister who says, I'm working on some sort of plan.
There's no way that we can agree to pay workers less wages. There's no way we can agree to domestic workers being paid less than what they currently get. We can't agree to farm workers being paid even lower than the slave wages they earn right now.
What is the role of lawyers in the fight against corruption in the country?
We've seen lawyers who knowingly that this client or who would have a reasonable apprehension that my client could be paying me from proceeds of the crime. I think it's about time that we legislation somehow considers how to discourage that type of conduct by lawyers themselves.
Where are the gaps as a person who has thoroughly interrogated the 4IR space and how it will have impacts on the country?
One of the unfortunate consequence of the fourth industrial revolution is the possibility of increase in inequality.
People with drug addictions cannot control their addictions without highly specialized help. One place that offers help is the Westview Clinic in Roodepoort. The center houses about 40 addicts, and amongst them we spoke to Cheslin Bingham, who started experimenting with drugs from high school.
I was still in school. You know, the reason why I actually started using drugs and stuff, because I wanted to fit in. You know, I wanted to be with, how can I say, the cool guys, you know, if I can put it that way.
Addicts would rather adjust their lives with drugs to enable them to continue with the substance use.
I couldn't go on without it. My life became unmanageable. Like, even at school I started selling because I just wanted it with me, you know. I had no confidence whenever I didn't have drugs, so I had to constantly use and use just to keep going. It became my lifestyle.
Interpersonal relationships get affected because of drugs. Now, Cheslin almost lost it all.
My life was just unmanageable. I could not, I lost my job. My mother put me out of the house. My grandmother, my child also, things like that. I just came to a point where I told myself, you know, I can't go on like this.
Someone who managed to change after many attempts is Thabang Tau, also known as the township councillor. Thabang was also once a resident at the Westview Clinic, and he tells us how he got addicted.
I started experiencing drugs in 2004. The reason it was I wanted to fit in.
Shockingly, at the age of 15, Thabang was enjoying taking drugs and he didn't want to stop.
To be truly speaking, that time I was enjoying. It was not difficult for me to quit, but it was difficult for me to accept that they are not good, you know, because it was all the enjoyment, the fulfillment that I was getting there.
Fast forward years later, Thabang realized that drugs are now taking over his life as he wasn't able to do the things that he used to do before.
I can't go to the soccer while I know I must get some fix for my habit, for my addiction, because drugs are jealous. It's like a jealous wife. It doesn't want you to share with soccer, with something. You'll share it with only the drugs that you use.
After 3 attempts of quitting, Thabang explains why it failed and how he then managed to finally quit.
It was not all about I wanted to quit drugs. It was all about I wanted my parents to be happy.
Cheslin is encouraging those who are experimenting to stop while they can, and Thabang is full on his township quest to educate and motivate those who are already addicted.
Not many of us make it, you know, to be able to come to rehab. There's others that die. So I'd advise to stop while you still can.
Usually a recovery addict to have been there, and we know how was that pain we feel there, you know. We're there to support them, so to
and everybody performs
to see that recovery is possible.
Recovery is possible indeed. All right, we continue with our discussion. We still have Dr. Shabalala from the #1 Military Hospital and, of course, David Bayer from Central Drug Authority. Now, we're joined by another special guest, Benny Pele. Now, Benny is somebody who has agreed to share his own personal story with us of just how he has overcome the problem of alcohol addiction. Welcome to Health Talk.
Greetings, Doc. Thank you.
All right. Perhaps let's start with you. Tell us your journey.
Well, my journey has been a very interesting one over the years. You know, I remember where I grew up, I used to see elders, uncles, aunties, you know, over when they socialize, alcohol would be the common thing. You know, in ceremonies, whether it be a wedding, a party, a funeral, whatever the case would be. So this was the norm, you know, socializing like that, whereby alcohol would be easy to get hold of, you know. And I started, I think, in higher primary, where I started, and this was just us experimenting and having fun. But while growing up, one crossed the invisible line, you know, as they say. And now the alcohol became a need, you know, instead of something that we would use to socialize with.
And you were still at school at the time?
I was still at school at that time. I was now in high school, you know, and if I didn't have any money, you know, to support my habit, we would go and do things that are illegal to get hold of money to support my habit, you know. And at this stage, I was now a member of a gang. I'm an ex-gang member myself, you know, and so it grew up into being a necessity whereby if I were to study, I would have to start having some form of alcohol substance within my body. You know, if I'm to do anything wherever I am sent by others, I would use the money that I'm supposed to buy whatever it is that I was sent to go and buy. With that money, and I would never come back. You know, we got involved in fights, you know, where we would terrorize the communities around where I lived, you know, and this was very sad at that time because I wasn't even aware.
Yeah.
With us, this is how we thought this was respect in the community. If people were scared and afraid of us, this is what we defined as respect with us. Little did I know that, no, this is where people being terrified rather than respecting us, you know. And I only knew this definition once I had been enlightened and once I was aware that I do have a problem. Because
So tell us about that. How did you then cross the line back, as it were? What made you aware that you had a problem?
It was now over the years. I think this was 14, 15 years later. I had this conscience within me, this inner voice that kept on asking me if this is what I really wanted to do with my life. You know, this is who I wanted to turn out. And I always knew that I wanted to do something better with my life, you know, that one day I had to be a family father. And what kind of a family father would I want to be? So what happened, I had to realize first that I do have a problem with alcohol. You know, once I start drinking and I am unable to stop. And things that I do when I am drunk are the things that I don't normally do when I am sober, you know. And I was told that that's what qualifies me to be an alcoholic, you know. And Dr. here mentioned about the substance abuse, you know. He defined abuse as an abnormal use of a substance, which is what I did. Well, once I started doing that, I was told that my problem, the one that kills me, is my first drink. You know, if I can avoid the first drink, then I don't get to drink the last one. As a result, I don't get drunk.
Right.
And when I'm sober, I will always do.
But
and
what helped you, you know, get over that?
I went to a rehabilitation center.
Right.
And then I got help there. This is when I was made aware, you know, of substances and what they could do and the effects that they could have psychologically as well as physically in me, you know. And then when I came out of rehab, I joined an organization, you know, that assisted me, which I won't mention by the name currently. So I had to admit, you know, that I do have a problem firstly for me to be able to get help and assistance and be able to accept and welcome that help that was offered to me. And 11 years later, here I am. I have repented, you know, I have went back to and made amends to those that I have wronged in the past, you know. Now I'm a reliable member of the community.
Well done.
Where I live, you know. I'm a family man today. I'm a father to my kids.
So you live in testimony that it is possible.
I am a living testimony. Indeed, it is possible. Yes.
So we spoke, I mean, if Dr. Shabalala, about, you know, the impact, I mean, clearly on health. I mean, it's been quite obvious, you know, social life and so on. But let's try and focus on the risk factors, you know, to try and kind of work towards prevention. Can we identify risk factors for abuse?
Yes, there's lots of risk factors. He mentioned one here, being the socialization. As children grow up seeing adults using alcohol, it becomes a norm. It becomes something that they aspire to. The second risk factor we saw on the screen, wanting to fit in.
Yeah.
Why would you want to fit in? People who want to fit in are people with a low self-esteem. Because if we look at alcohol, if we dissect alcohol psychologically, we find that they've got a harsh superego. In other words, they cannot face life in the sober state. So they have to be drunk in order to enable them to do what it is that they want to do, wanting to fit in. Other people have got underlying depression and they're trying to self-medicate, underlying anxiety and depression. They're trying to medicate. There's many other risk factors like availability of money. Boredom. People who've got a lot of time in their hands and they don't know what to do with it, they resort to drug and alcohol use. So those are the risk factors we see throughout our communities, you know.
Let's perhaps get another perspective from the department?
I think that one of the biggest risk factors that we've got is coming from a dysfunctional family and the home environment that people are brought up in. Also the fact that society itself very, very often condones the behavior of people drinking and society's approach to these people. The other thing is very often they find, as mentioned earlier, because of the low self-esteem, that they feel excluded and they want to be part of the in-group, and the only way to become part of the in-group is to do what everybody else, and the peer pressure that they then put under. Another issue is the unemployment, and very, very often they find that because they're unemployed, they need something that's going to give them a source of income, and they start getting involved with gangs, and with the gangs they then get introduced to it as well. So these are some of the big issues. Other vulnerabilities are, for example, people who work under certain conditions, where within that the norm is to consume, whether it be the alcohol, whether it be cocaine, which is a stimulant in order to make them be able to function for longer periods during the day, and all that type of thing. So it's not necessarily only just about the drug. What we've also got to concern ourselves is about the environment that people find themselves in, which is the temptation that generates them to actually want to use more and more. But from my perspective, I think what is of major concern is the fact that they lose control. And that is the factor that we have to bring back. And once they can gain control, it means that they need to be rehabilitated, which we understand clearly. But that means directing them using cognitive behavioral therapy, showing them that there are skills developments that they can undertake, which then gets them to the point, and I salute you for being where you are at the moment, for having done all of that. The other issue is that we must also recognize that this is a brain disease. The new definition that we're talking about is that once the brain has recognized the effect that any one of these substances can have, the brain will keep reminding you that rather than feel down, rather than feel depressed,
something else
just automatically the brain reward system reminds you that just take some more, the rechmarke in the morning. That gets you over the problem. And that is where the problem comes in.
Talk about disease. I mean, we understand that most of it is environmental. But is there a genetic element?
There is a genetic element. I remember when I was a president of SASOP, we had quite a discussion with the medical aid society in which we advanced the knowledge that alcoholism is a disease waiting to happen, and you've inherited it from your parents, and so that that allowed us to persuade them to pay for rehabilitation, because they otherwise wouldn't. The notion was that it's a self-inflicted disorder. But I can tell you that alcohol is an inherited disorder. You get it from your parents, and it's waiting for you to drink. You know, but if you don't drink, you won't know that it's there. So it is a genetical. We have even identified the particular genetic alleles where alcoholism resides. And to just add on this. They did twin studies in which two identical twins born of alcoholic parents were brought up in different countries. And they started drinking at the same time. And they became alcoholic at the same time. Having said that, I do not want people to think that drinking is okay because I have inherited the gene. I'm not promoting anything. I'm just saying it is a disease waiting to happen.
All right, okay. I think we're going to have to leave it at here. And I want to say special thank you to Benny for sharing your story with us, and I'm sure it will, help a whole lot of other people watching this show. And all the best.
Thank you.
All right.
Thank you.
Time for another quick break. When we come back, we'll continue our discussion on alcohol and substance abuse. Please stay with us.
Here's a minister who says, I'm working on some sort of plan.
There's no way that we can agree to pay workers less wages. There's no way we can agree to domestic workers being paid less than what they currently get. We can't agree to farm workers being paid even lower than the slave wages they earn right now.
What is the role of lawyers in the fight against corruption in the country.
We've seen lawyers who knowingly that this client or who would have a reasonable apprehension that my client could be paying me from proceeds of the crime. I think it's about time that legislation somehow considers how to discourage that type of conduct by lawyers themselves.
Where are the gaps as a person who has thoroughly interrogated the 4IR space and how it will have impacts on the country?
One of the unfortunate consequence of the fourth industrial revolution is the possibility of increase in inequality.
Finance Minister speaking last year was quite clear that one, he doesn't want a constant bailout of state-owned enterprises, including SAA. And then he also said there's no reason for SAA and we can get rid of it.
The one that people are talking about is the issue of privatization, but I don't think that privatization is within the horizon at the moment. But what I can say is the liberalization of the aviation industry may be on the horizon.
Talk to us about the share that the continent gets as compared to the rest of the world.
$1.85 trillion globally, 2.5% of that went into Africa in 2018. For us, the number one most critical issue in the energy industry of Africa is investment.
It's time for us to be real stewards of our resources.
Welcome back, and thank you so much for staying with us. We're discussing alcohol and substance abuse with our guests. We had Dr. Jan Shabalala earlier. We now have a special guest joining us, Prince Maphumulo. Now, Prince is another individual who's going to share his own personal story around how he has overcome this problem of substance abuse and addiction. Welcome to Health Talk, Prince.
Thank you for inviting me, Doctor.
All right. Like I did with the previous guest, let me start with you.
Yes.
Share your story with us, as brief as you can make it, yeah?
Okay, firstly, when you talk about addiction,
Yeah.
you know, what is it exactly that a person is addicted to?
Yeah.
You know, you're addicted to a feeling because you want to feel different.
Right.
Because you want to move from this state into a different state because you don't want to feel how you feel now.
Yeah.
So for me, when I was young, I really hated myself for certain type of reasons. I didn't love myself. I didn't love who I was. I couldn't fit in. I was bullied quite a lot. And I hated how I felt. And I really wanted to feel different. And I asked myself, how can I be able to change how I'm feeling? You know, and through that, in my community, most of the drug that was basically available and widely used, it was Mandrex. But because of how I saw how it affected the people around in my community, I was like, this is not what I want to do. And I chose cocaine because what I saw on TV, people were high on cocaine, they look happy.
Yeah.
You know, they look like, you know, they got it all together. And I said, this is the kind of drug that I want to use. And these people...
It's interesting that he mentions these are drugs that were, you know, easily available. You want to comment on that?
Absolutely. Unfortunately, as I said, whatever's available anywhere else in the world is also available now in South Africa.
Yeah.
But cocaine is very readily available in South Africa. We have a very high percentage of people who are abusing not only cocaine, but any of those stimulant types.
Yeah.
The amphetamines are the other one.
Yeah.
The tic that we talked about earlier is also another one of those stimulants.
Yeah.
It's the stimulant that gives you that euphoric feeling, that lifts you out of that depression.
Yeah.
And once the brain has recognized that this is what it's capable of doing for you, it keeps reminding you every time you start feeling a little bit lower, that hang on, wait a minute, just go and consume some more, and you'll be feeling exactly the way you want to feel.
Yeah.
It's the mindset of using something chemical to change the way you feel that we have to overcome.
Yeah. Let's carry on with you. So what age then, how old were you when you started experimenting with this?
Oh, I was very young because I think I was in grade 10 at the time. I was in grade 10 at the time, and then I started experimenting with coke, and it was my first time. I bought it, and I found a friend who actually got it for me, and he came with it, and then I took that to school. That was rough. So I started using from then, and it made me feel good. It made me feel good. I really loved the feeling. You know, in fact, nobody actually forced me or encouraged me to go and do drugs. It wasn't peer pressure for me. It was different. And I started using from that time, and then it carried on. It became a lifestyle. And my parents tried to talk me out of it, and I manipulated and I lied quite a lot, and make sure just do whatever that they wanted me to do so that I can.
How did it
impress
affect
them.
your social and functionality?
It really affected my my life quite a lot, and because I became, because when you're addicted, you start isolating yourself from people, and the people that are around you, you start taking things from people, you start stealing, and I even lost my I work for one of the two greatest companies in South Africa, which I won't mention, and I lost my job twice. Because of that. And one company I was working in the financial department, so I stole money from that because I had to feed my habit. And I found myself over the period of years, because I was addicted for 14 years, and I found myself in the process that I had to go and also sleep on the streets. So I slept on the streets, and because of the reason I went to go and sleep on the streets is because now I was ashamed, because I was living a certain lifestyle. And now, because I'd lost everything, I've reached a threshold in my life. And after reaching a threshold, losing everything, which is called rock bottom in the language of the drug world, I was so ashamed, and I had to, run away from the community and live in the streets because of how people used to label me and how they used to see me before I had lost that respect. Now,
How long were you in the streets for before you got help?
Basically, in the streets before I got help, I used to. I wasn't like full time in the streets, so I used to go in the streets and also come home once in a while. So in a period of over 3 to 4 years, I used to do that. So I used to go missing from home for about 2-3 months. Come back maybe for about 2-3 days and steal whatever I have to steal. Go back in the streets. So it was like that.
And then what happened? The switch.
The switch.
To say
I had reached a threshold. I had reached a threshold in my life. Because it was painful. In the past, a threshold is when you understand that it's painful in the past and it's painful in the present. It's also going to be painful also in the future. And I also, because I didn't know who Prince was. And the reason was most of the time we don't know who we are as human beings. We don't know who we are. We know our names, we know our surnames, we know where we come from, which is our identity has to do with people. When you talk about identity, they talk about content. When you talk about your past, your present, and what you've been through and all that, that is content. But when you talk about essence, finding out who you truly are from within. And then when I reached that point of starting to search, wanting to know more about me, I remember I went into a church because I was still sleeping in the street in around Rosettenville. So I walked up from a park one time. So I knew that this church, they used to do Thursday night for addiction nights. So I went there, and then I found a pastor there, and then he spoke to me, and then the next day he took me to rehab. But even in that rehabilitation, I didn't stay. I left the very same day. But I went back home, and then when I went home, that is when my mother was so excited to see me, because they even thought maybe I was dead. They were so happy. And then
But you ultimately went through rehab, and
yes,
you
I
got
decided
help.
from there. Then I decided to go to rehab on my own. And I went to rehab. And when I was in rehab, I even told my family that they mustn't even come and visit me. I need to take accountability for my actions so that I can be able to change.
So how long have you been clean, as it were?
It's been 3 years now.
3 years?
Yes.
Wonderful, wonderful. Let's talk, before we run out of time, it's important that we talk about prevention, and we visited the subject of risk factors. Perhaps let's start with you in terms of programs that are there in place to prevent substance abuse.
I think at the same time I want to just pick up on a point that has been made here, and that is that the best prevention that we have is education.
Right.
And people need to understand what the consequences are that they will be living with for the rest of their life when they decide to use something chemical in order to change the way they're feeling. It's not about what you're seeing at the moment. It's not about the immediate gratification. It's about what is the consequence going to be later down and the prognosis going forward. And that is what we need to make sure that the public are made aware of, and that those prevention actions. So what we're doing with prevention is we've got programs that are being run at the school through the Department of Social Development, the K-Mojo program, I'm Fine Without Drugs, where we're trying to educate the youth. At the same time, we've got a higher education program as well at the TVETs, where students who are now coming to universities and to the technical colleges for the first time are partnered by people who are there to be able to protect them, because all of a sudden they're no longer under the influence from home. They've moved from a rural area into a completely different environment, and they find that all of a sudden they're liberated or whatever it is, that they need to be guided along those ways. So those are two very important areas that we need to worry about, and we are preventing that by making sure that we have these programs running at both levels of education departments. The youth in particular are the ones that need to be protected, and we understand that they are the future for the country, and that's why we continually focusing on the youth. At the same time, we also need to recognize that there are certain people who, unfortunately, will need to be medicated in order for them to prevent them from relapsing all the time. And it's that relapse that we have to make sure. Once the person has been rehabilitated, that person is on the straight and narrow. There's only, as you said earlier, only one drink away from being an alcoholic again.
We're going to talk about that.
We need to then help
relapse
in order to prevent them.
All right, no, wonderful. Just shortly before we go on a break, from an AA's perspective, I mean, do you have any prevention programs?
Yes, we do quite a few talks. We go out and empower people about the effects of alcoholism, the effects of on the family as well. And one looks at it holistically. We've spoken about rehabilitation centers, but we have to look at support groups. These are outpatient programs, and it's free. All the Narcotics Anonymous support groups and Alcoholics Anonymous support groups are all free. So are Al-Anon for the families of alcoholics, and so is Alateen for teenagers who find themselves in this predicament.
Let me take this opportunity to thank you so much, Prince. And Prince, I didn't mention, by the way, he's also a life coach, so look out for him. And I can only wish you the best for...
Thank you very much for inviting me.
All right, time for another quick break. When we come back, we'll now wrap up our discussion on the substance and alcohol abuse and look at treatment and rehabilitation. Please stay with us.
This is where we take a look inside the world of media, analysing the trends, the issues and the reporting of some of the week's top stories.
One of the things that we are seeing across the globe, people are consuming news and living their lives with their mobile devices.
The evolution of journalism is to use the same skills, the same ethics, the same values, but to cater to different audiences because it's not the same people.
There is a lot of debate in this industry today whether the future is about digital paid content. Will there be a market for users to pay for digital content? And we see that in Africa it's a challenge.
People will go, pay for a newspaper, take it away. Why won't they pay for it online?
In the initial stages of shifting from print to online, we created the impression that what people were paying for was the paper. And so people are very reluctant to pay for the journalism, and good journalism is very expensive.
Watch Media Monitor Sundays at 9 a.m. We don't only show you what's trending, but also travel far and wide to find you hidden gems. We go deep into untapped territories, bringing life in its simplest form. Catch Trends Travel every Saturday at 8:30 p.m.
Welcome back. Now, as we heard, I mean, it is possible that people with this type of problem can actually get help. Treatment is available, and it is possible that people can even overcome this problem completely, as we heard from our two previous guests. It's a great pleasure now to welcome our other special guest, Anthea Burial. Now, we saw a clip earlier, about Westview Clinic. Now, she is the inpatient manager at Westview Clinic. Welcome to Health Talk, Anthea.
Thank you for having me.
All right. Perhaps let's start with you, Dr. Chabalala. Let's talk the principles of treatment, before we talk about rehabilitation. The principles of treatment for this problem.
The first principle really is the acknowledgement. Our two former users or addicts have alluded to this fact that, first of all, it has to come within,
right.
Because rehabilitation is really a patient-driven, patient-oriented process. Without the the awareness and the determination from the patient themselves, we're not getting anywhere. So that's the first principle, that they need to be aware and accept that they do have a problem. And the second one, obviously, all addiction is inpatient management. There's no way you can manage a patient. I often hear people say, but I can do this at home. You cannot do this. You cannot rehabilitate yourself at home. You know, you need to go in there, because there's certain things that you're going to learn on an inpatient principle, you know. So it's acknowledgement and admission and then inpatient management.
Okay. And of course, you give them all sorts of drugs and psychotherapy and all of that.
Yes, we can go into the details if
All
we've
right.
got time.
We don't need to. But I think we have interest in understanding exactly what happens in a rehabilitation center. And Ante is there to take us through that process. So here's somebody brought by parents, willingly,
Yes.
of course, you know, to go through the rehab process.
Yeah.
Take us through what happens.
Obviously, we look at assessment level. That's before admission to the facility. You need to take into account the nature, the extent, the history of the problem, because outpatient, something like outpatient treatment will not work for someone who's still in active addiction, and we're talking about a 10-year history.
Yeah.
So once we get through that phase of treatment, then we're looking at admission into the clinic, which includes the detox. Remember, to minimize the potential severe withdrawal symptoms of the patient. And then along with that is also the cognitive behavioral therapy by way of individual, group therapy that we have daily, and also family therapy, because it's also important to involve the family at this stage, because there's about 16 people are affected by someone, you know, through their addiction and so forth.
So it
it's
sounds
important.
like it's a multidisciplinary
Yes,
type
yes,
of,
a more
you know,
holistic
who's
approach
involved?
too.
Yeah?
We have obviously medically the doctor. We have 24-hour nursing staff available, and then also in terms of support groups now. So when someone leaves the clinic, we're looking at aftercare services, which is so important, because research has shown that people who engage and participate in aftercare are more able to sustain their sobriety in the long term than to just focus on detox phase. You know, when you're physically feeling well and you're off the drug, it's about facing life now without the drugs and those triggers and how to handle them. So a part of the cognitive behavioral therapy is to look at the decisions and the influences and what drives our behavior, things like that. So that's important that we focus on.
Yeah. So one of our guests earlier said that to his parents, that I don't even want you to come and visit me when I'm at rehab.
Yes.
Now, what role do parents play, or what role do parents what should they be playing, in fact?
You know, it's so important to educate the loved ones when it comes to addiction, because some people might think they're helping, but then you're looking at something like codependency, where the intention is to assist the person, but, you know, to save your child or your loved one from the consequences of their behavior is also not going to assist them in any way. So we educate the parents. It's very important. We have also what we call a SOS group, significant other support group, that happens at the clinic, where we don't involve the patient. That's only for the parents, that's only for the loved one, that's only for people who want to learn more and understand better what their role should be now beyond when the person is discharged from the facility and such. Yeah.
Let's understand from an alcoholic's perspective now, in terms of, you know, rehabilitation and support afterwards. I know you touched a little bit on support groups, but
well, there's a hybrid of services that's being offered, but AA believes in the outpatient or support group service. And you've heard of the 12-step program, which basically looks at three key aspects: behavioral treatment, cognitive aspects, and then spiritual. There's quite a high emphasis on spiritual and knowing your higher power, and in that way, overcoming your dependency or your addiction.
And generally, somebody mentioned before the break, actually, the whole issue of relapse. Just take us through the rates of relapse, or your experience with relapse, both from a drug perspective and an alcoholic perspective.
When you know, it's important to focus on, like when you deal with something like nyaupe addiction or heroin addiction, the relapse rate is very high for those people, purely because people want to stave off the potential withdrawal symptoms, which are very uncomfortable, and they go through severe withdrawal symptoms. So the relapse rate when you're looking at those specific drugs are very high. And also something like alcohol, when someone is at the stage where there's physical, the addiction has impacted physically on them, like when there's liver cirrhosis or things like that we need to talk about. So it's very difficult in terms of the decision to now stay sober, but then you have these lasting ailments that because of the addiction that stay with someone. So it's about stabilizing that aspect of the treatment as well. So sobriety and relapse is not just about the physical side of this abstaining from using the drugs. It's also about what you feed yourself now in terms of on a emotional level, psychologically. Let's focus on emotional sobriety, which many people we don't even discuss it, but at aftercare level, we look at issues like that. I think Prince mentioned earlier, the earlier guest, about how you don't know yourself really because you don't go through. So it's about searching for this feeling. So you never know what makes you tick. What are your dreams? What are your passions? What are your ambitions in life? So it's about getting back to those basics, you know.
Before we run out of time, I want to give you each one 30 seconds just for your concluding thoughts. Let's start with you.
I think it all boils down to the environment as well. We all have a sense of belonging.
Right.
We have the sense of agency, but I think our dysfunctional environments, the high poverty rate, the high unemployment rate in our country, all takes away our sense of agency.
Right.
And in terms of consolidating our sense of belonging, one takes to addictive substances.
Okay. Dr. Sebalana?
Yeah, look, addiction, substance abuse and addiction is a very serious problem. It is here and it is here now. And I think people should take responsibility for their own lives. And I think people should stop looking for an excuse. I'm drunk because my parents or my girlfriend and I fought. You have to take responsibility for your life. You have one life and it's your responsibility.
Right. I think that on that note that we're going to have to leave it for today. I want to thank you so much for all the insight that you've brought us into this show. And to you folk at home, thank you so much for watching. And at this time, of course, we want to wish you happy holidays and please do take care. We're back with you again in a week's time. Cheerio.